The reflection in the mirror can, for many women approaching or navigating their postmenopausal years, begin to tell an unexpected and often unwelcome story. Beyond the wisdom etched in laugh lines or the silver threads appearing at the temples, a more distressing change may become apparent. A noticeable thinning of the hair, a widening part, or an increase in strands left on the brush or shower floor. This experience, far from being a mere cosmetic concern, can strike at the very core of a woman's identity, confidence, and sense of self. Hair, often intertwined with femininity and vitality, thinning or shedding can evoke profound feelings of loss, anxiety, and even grief. While numerous factors can influence hair health throughout life, the significant hormonal shifts that define menopause, particularly the dramatic decline in estrogen, stand out as a primary orchestrator of hair loss in older women. Understanding this intricate connection is the first step towards addressing it, empowering women with knowledge to navigate these changes and explore pathways to support their hair's health and resilience. This journey into the science of menopausal hair loss will illuminate how estrogen, a hormone so central to female biology, plays a pivotal role in maintaining luscious locks, and how its departure can disrupt this delicate balance, leading to the common yet deeply personal challenge of hair thinning. To truly grasp why the decline of estrogen after menopause can have such a profound impact on hair, we must first appreciate the hormone's fundamental role in the complex biology of hair follicle health and the intricate dance of hair growth cycles. Hair follicles, the tiny, dynamic organs embedded in our skin from which hairs sprout, are not static structures. They are constantly cycling through three main phases: anagen, the active growth phase; catagen, a short transitional phase; and telogen, the resting phase, at the end of which the hair is shed and the follicle, ideally, re-enters anagen to produce a new hair. Estrogen, particularly estradiol, the most potent form of estrogen active before menopause, acts as a crucial supportive factor for these follicles. Scientific research has identified estrogen receptors directly on hair follicle cells, meaning these cells are primed to listen and respond to estrogen signals. One of estrogen's most significant contributions is its ability to prolong the anagen phase. A longer anagen phase means hair grows for a more extended period, contributing to greater hair length and overall density. Furthermore, estrogen is believed to stimulate the proliferation of dermal papilla cells, which are critical for initiating and maintaining hair growth. It also appears to influence the production of local growth factors within the follicle, creating a nurturing microenvironment that supports robust hair production. Some studies suggest estrogen may even play a part in increasing hair shaft diameter, leading to thicker, stronger individual strands. It's also thought to counteract some of the follicle miniaturizing effects of androgens, the group of hormones that include testosterone, which, as we will see, become relatively more influential after menopause. In essence, premenopausal levels of estrogen act as a protective and growth-promoting force for the hair, contributing significantly to the fuller, healthier hair many women experience during their reproductive years. Menopause, a natural biological process marking the end of a woman's reproductive capacity, orchestrates a profound hormonal upheaval, central to which is a significant and relatively abrupt decline in estrogen production. This transition typically occurs between the ages of 45 and 55, though it can vary. The ovaries, which have been the primary producers of estrogen, mainly estradiol and estrone throughout a woman's reproductive life, gradually reduce their output. During perimenopause, the years leading up to the final menstrual period, estrogen levels can fluctuate unpredictably, sometimes wildly, before taking a decisive downturn. Once menopause is reached, defined as 12 consecutive months without a menstrual period, the ovaries have largely ceased their estrogen-producing function. While other tissues, such as adrenal glands and fat cells, continue to produce small amounts of estrogen, primarily estrone, a weaker form, the overall circulating levels of biologically potent estradiol plummet dramatically, often to less than 10% of premenopausal concentrations. This isn't a gentle tapering off for many. It's a systemic shock to a body that has, for decades, relied on higher estrogen levels for a multitude of functions, from bone health and cardiovascular protection to skin elasticity, and, crucially for our discussion, hair follicle vitality. This steep drop in estrogen is not an isolated event. It fundamentally alters the body's entire endocrine landscape, setting the stage for a new hormonal balance, or rather, an imbalance that can directly impact hair. This dramatic reduction in estrogen during and after menopause doesn't just mean less of a female hormone. It critically shifts the hormonal seesaw, leading to a state of relative androgen dominance. Androgens, often thought of as male hormones like testosterone, are naturally present in women, produced in smaller amounts by the ovaries and adrenal glands. Before menopause, higher estrogen levels effectively counterbalance the effects of these androgens. Estrogen also stimulates the liver to produce sex hormone-binding globulin, a protein that, as its name suggests, binds to sex hormones, including testosterone, in the bloodstream. Bound testosterone is largely inactive. However, as estrogen levels fall precipitously during menopause, SHBG production also tends to decrease. This results in a higher proportion of free, biologically active testosterone circulating in the body, even if the absolute production of testosterone by the aging ovaries and adrenals might also slightly decrease. The crucial factor is the ratio of estrogens to androgens. With estrogen taking a back seat, the existing androgens wield a much greater influence on target tissues, including the hair follicles. Furthermore, within the hair follicle cells themselves and in the surrounding sebaceous glands, an enzyme called 5-alpha reductase can convert this free testosterone into an even more potent androgen, dihydrotestosterone. DHT is notorious for its detrimental effects on genetically susceptible hair follicles. It binds to androgen receptors on these follicles with high affinity, initiating a process called follicular miniaturization. This is the same primary mechanism behind male pattern baldness and is a key player in what is known as female pattern hair loss or androgenetic alopecia in women, which becomes increasingly prevalent after menopause precisely because of this estrogen-androgen imbalance. The follicles don't die, but they shrink, producing progressively finer, shorter, and less pigmented hairs, until they may eventually cease to produce visible hair altogether. The physiological mechanisms translating this estrogen decline and relative androgen increase into visible hair thinning and shedding are multifaceted. Firstly, the loss of estrogen's supportive influence means a shortening of the anagen growth phase of the hair cycle. Hairs that would have grown for several years might now only grow for a few months or a year before prematurely entering the catagen, transitional, and then telogen resting phases. Simultaneously, the telogen phase may become prolonged, meaning follicles remain dormant for longer periods before re-entering anagen if they do so effectively. This results in fewer hairs actively growing at any given time and an increased number of hairs being shed as they complete their shortened cycle, a condition often manifesting as increased daily hair fall, technically known as telogen effluvium, which can be superimposed on the more gradual thinning of FPHL. Secondly, as discussed, the unmasking of androgen effects, particularly those of DHT, leads to follicular miniaturization. Each subsequent hair cycle produces a hair that is slightly thinner in diameter and shorter in length than its predecessor. Over time, thick, pigmented terminal hairs are progressively replaced by fine, wispy, vellus-like hairs, which provide much less scalp coverage. This process doesn't happen overnight, but is a gradual, insidious creep that can take years to become noticeable. The overall effect is a reduction in hair volume and density rather than distinct bald patches typically seen in men. The hair may feel less substantial, ponytails become thinner, and the scalp may become more visible, especially under bright light. These changes are a direct consequence of the hair follicle's response to the altered hormonal milieu, where the protective, growth-promoting signals from estrogen are diminished and the miniaturizing signals from androgens become more dominant. The typical patterns and signs of hair loss seen in postmenopausal women, largely classified under the umbrella of female pattern hair loss, FPHL, reflect these underlying hormonal and follicular changes. Unlike male pattern baldness, which often starts with a receding hairline and balding at the crown, vertex, FPHL in women usually presents more diffusely. One of the most common early signs is a gradual widening of the central part line. Women may notice they can see more of their scalp along their part than they used to. This thinning tends to be most pronounced over the crown and top of the scalp, sometimes described as a Christmas tree pattern when viewed from above, wider at the frontal aspect of the part and tapering towards the back. While there can be some thinning at the temples, the frontal hairline is generally preserved in most women with FPHL, which is a key distinguishing feature from typical male androgenetic alopecia. The hair loss is characterized by a reduction in hair density, fewer hairs per square centimeter, and a decrease in the caliber, thickness of individual hair shafts due to follicular miniaturization. It's rare for postmenopausal women with FPHL to go completely bald in the way men can. Instead, the thinning can progress to a state where the scalp is quite visible, but a sparse covering of hair usually remains. The onset is often insidious, starting subtly in perimenopause and becoming more apparent in the postmenopausal years. Some women may also experience episodes of increased shedding, telogen effluvium, concurrently, especially during periods of significant hormonal fluctuation or stress, which can exacerbate the perception of thinning. Recognizing these characteristic patterns is crucial for distinguishing FPHL related to estrogen decline from other potential causes of hair loss, allowing for more targeted management strategies. The impact of estrogen reduction extends beyond the hair follicles themselves to affect the overall health and condition of the scalp, creating an environment that may be less conducive to healthy hair growth. Estrogen plays a vital role in maintaining skin health throughout the body, including the scalp. It contributes to skin hydration by supporting the production of hyaluronic acid and maintaining the integrity of the skin's barrier function, which helps to retain moisture. Estrogen also influences collagen and elastin production, contributing to skin thickness and suppleness. As estrogen levels wane after menopause, the scalp skin, like skin elsewhere, can become thinner, drier, and less elastic. Many postmenopausal women report increased scalp dryness and itchiness, pruritus. This dryness can make the scalp feel tight and uncomfortable and may lead to flaking, sometimes mistaken for dandruff. Furthermore, estrogen has anti-inflammatory properties. Its decline can potentially lead to a state of increased low-grade or subclinical inflammation in the skin. While not always visibly apparent, this subtle inflammation around the hair follicles, perifollicular inflammation, can further stress the follicles and may contribute to the progression of hair loss. A dry, irritated, or inflamed scalp is not an optimal environment for hair growth. Reduced sebum production, also sometimes linked to hormonal changes, can exacerbate scalp dryness, although paradoxically, the relative increase in androgens can sometimes stimulate sebaceous glands in other individuals, leading to an oilier scalp. The key takeaway is that estrogen's absence alters the scalp's ecosystem, potentially compromising its ability to support robust hair follicles and possibly aggravating the hair thinning process initiated by direct hormonal effects on the follicle cycle. Given the profound internal hormonal shifts, fortifying the body from within through targeted nutrition becomes an essential supportive strategy for women navigating menopausal hair loss. While diet alone cannot reverse hormonally driven hair loss, it can provide the crucial building blocks and cofactors necessary for optimal hair follicle function and scalp health.
Essential vitamins play a significant role. The B-complex vitamins, particularly biotin, B7, are renowned for their role in keratin production, a key protein that makes up hair. Other B vitamins like B6, B12, and folate are involved in cell metabolism and the formation of red blood cells, which deliver oxygen and nutrients to the hair follicles. Vitamin D, often deficient in older adults, is increasingly recognized for its role in hair follicle cycling. Vitamin D receptors are present in hair follicles, and low levels have been associated with various types of hair loss. Vitamin C is critical not only as a powerful antioxidant that protects follicles from oxidative stress, but also for collagen synthesis, which contributes to scalp skin health and strong hair structure, and it aids in the absorption of iron. Vitamin E, another potent antioxidant, helps to protect cell membranes from damage and may improve scalp circulation. Minerals are equally vital. Iron deficiency, with or without anemia, is a well-established cause of hair shedding, telogen effluvium, and ensuring adequate iron stores, measured by serum ferritin, is paramount. Zinc is essential for hair tissue growth and repair, and it plays a role in the proper functioning of oil glands around the follicles. Selenium, required in trace amounts, contributes to antioxidant defense and thyroid hormone metabolism, both of which can influence hair health. Beyond vitamins and minerals, adequate protein intake is fundamental, as hair is primarily composed of protein, keratin. Ensuring sufficient dietary protein provides the necessary amino acids, like lysine and methionine, for building strong hair strands. Phytoestrogens, plant-derived compounds with a chemical structure similar to human estrogen, have garnered attention. Found in foods like soy, isoflavones, flax seeds, lignans, and chickpeas, they can exert weak estrogenic or anti-estrogenic effects in the body. While research on their direct impact on menopausal hair loss is ongoing and sometimes mixed, some women find incorporating phytoestrogen-rich foods beneficial, potentially by mildly buffering the effects of estrogen decline. Omega-3 fatty acids, found in fatty fish, walnuts, and flax seeds, possess anti-inflammatory properties that can benefit scalp health and may support hair growth. A balanced, nutrient-dense diet focusing on whole foods is the cornerstone, providing a synergistic array of compounds that support the body's overall health and, by extension, the health of the hair and scalp during this transition.
Alongside nutritional support, lifestyle modifications and regular exercise can play a surprisingly influential role in managing menopausal hair loss, primarily by helping to balance hormones naturally, reduce stress, and improve scalp circulation. Chronic stress is a notorious saboteur of hair health. It triggers the release of cortisol, a stress hormone that, in excess, can disrupt the hair growth cycle, potentially pushing more follicles into the telogen, resting/shedding phase. Menopause itself can be a stressful period for many women, and adding the anxiety of hair loss can create a vicious cycle. Therefore, incorporating stress management techniques is crucial. Practices like yoga, meditation, mindfulness, deep breathing exercises, or even engaging in hobbies can help to lower cortisol levels and promote a sense of well-being, indirectly benefiting hair. Regular physical exercise offers a multitude of benefits. It's a powerful stress reliever and mood booster. Crucially, exercise improves overall circulation, including blood flow to the scalp. Enhanced circulation means better delivery of oxygen and essential nutrients to the hair follicles, creating a more favorable environment for growth. Exercise also helps to improve insulin sensitivity and manage weight, which can be important as metabolic changes during menopause can sometimes influence hormonal balance in ways that might affect hair, e.g. conditions like polycystic ovary syndrome, though less directly related to menopausal hair loss, highlight the interplay between metabolic health and androgens. While exercise won't directly replace lost estrogen, it can contribute to a more harmonious hormonal environment and mitigate some of the factors that can exacerbate hair thinning.
Adequate, high-quality sleep is another non-negotiable aspect of a hair-healthy lifestyle. During sleep, the body undertakes crucial repair and regeneration processes, including those related to hair follicle activity and hormone regulation. Poor sleep can disrupt hormonal rhythms and increase stress, both detrimental to hair. Aiming for 7 to 9 hours of restorative sleep per night can support the body's natural mechanisms for maintaining health, including that of the hair. When lifestyle adjustments and nutritional support are not sufficient to manage the extent of hair thinning, an overview of available medical interventions becomes relevant. It's essential to approach this with a healthcare professional, typically a dermatologist specializing in hair loss or an endocrinologist, who can provide a proper diagnosis and discuss the appropriateness, benefits, and risks of various treatments. Hormone replacement therapy, HRT, which involves replenishing estrogen, often with progestogen if a woman has a uterus, can, for some women, alleviate not only systemic menopausal symptoms like hot flashes and vaginal dryness, but also potentially slow down or modestly improve menopausal hair loss by restoring some of the estrogenic support to the follicles. However, HRT is not without potential risks, such as cardiovascular events or certain cancers in specific populations, and is not suitable for everyone. Its use for hair loss alone is generally not a primary indication, but can be a secondary benefit if HRT is prescribed for other significant menopausal symptoms. The decision is highly individualized. Topical treatments are often the first line of medical defense. Minoxidil, commonly known by the brand name Rogaine, is an FDA-approved over-the-counter treatment for FPHL. Available in 2% and 5% solutions or foams, minoxidil is thought to work by prolonging the anagen phase, increasing follicle size, and stimulating blood flow to the follicles. It doesn't address the underlying hormonal cause, but can help to stimulate hair growth. Consistent, long-term use is necessary to maintain results. Other topical treatments, sometimes used off-label, may include ketoconazole shampoo, which has mild anti-androgenic properties, or custom compounded formulations containing ingredients like topical spironolactone or finasteride. Though evidence for topical anti-androgens in women is still evolving and must be carefully considered due to potential side effects and systemic absorption. For oral medications beyond systemic HRT, anti-androgen drugs like spironolactone are sometimes prescribed for FPHL in women. Spironolactone blocks androgen receptors and reduces androgen production, thereby mitigating their negative impact on hair follicles. Finasteride and dutasteride, which are 5-alpha reductase inhibitors blocking the conversion of testosterone to DHT, are used more commonly for male pattern baldness. Their use in postmenopausal women is off-label and considered if other treatments fail, but they are strictly contraindicated in premenopausal women of childbearing potential due to the risk of birth defects. Emerging technologies offer further options. Low-level laser therapy, LLT devices, available as caps, combs, or headbands for home use, emit red light that is thought to stimulate cellular activity and blood flow within the follicles, potentially promoting hair growth. Platelet-rich plasma therapy involves drawing a patient's own blood, concentrating the platelets, which are rich in growth factors, and injecting this PRP into the scalp to stimulate dormant or miniaturizing follicles. Hair transplantation remains a surgical option for women with more advanced FPHL and sufficient donor hair, where individual follicular units are moved from denser areas, like the back of the scalp, to thinning areas. Each of these interventions carries its own set of considerations, efficacy rates, and potential side effects, making a thorough consultation with a knowledgeable physician indispensable.
Beyond medical treatments and internal support, adopting practical everyday habits and gentle hair care practices can make a significant difference in minimizing further damage, preserving existing hair, and promoting an appearance of fullness and strength during and after menopause. Hair becomes more vulnerable with age and hormonal changes, so treating it with kindness is paramount. Avoid harsh physical stress on the hair. This means steering clear of tight hairstyles like high ponytails, tight braids, or buns that pull excessively on the hair follicles, which can lead to traction alopecia, a type of hair loss that can exacerbate FPHL. When detangling, use a wide-tooth comb, starting from the ends and working your way up to the roots to minimize breakage. Reduce the use of high-heat styling tools like flat irons, curling wands, and blow dryers on high settings. If heat styling is necessary, always apply the heat protectant spray and use the lowest effective temperature. Consider air drying your hair whenever possible. The choice of hair care products also matters. Opt for gentle, sulfate-free shampoos that won't strip the scalp and hair of their natural oils, which can worsen dryness. Look for conditioners that are moisturizing and nourishing. Volumizing shampoos and conditioners can help to make fine hair appear thicker and fuller without weighing it down. Regular, gentle scalp massage can be beneficial. It can help to improve blood circulation to the scalp, potentially delivering more nutrients to the follicles, and it can also be a relaxing ritual to reduce stress. Use your fingertips, not fingernails, to make small circular motions across your entire scalp for a few minutes daily. Be cautious with chemical treatments like permanent coloring, bleaching, straightening, or perming. These processes can weaken the hair shaft, making it more prone to breakage, especially if hair is already thinning. If you choose to color your hair, consider gentler, ammonia-free options, extend the time between treatments, and ensure your stylist is aware of your hair's condition. Protecting your hair from environmental aggressors is also important. Prolonged sun exposure can damage the hair cuticle and scalp, so wear a hat or use UV protective hair products when spending significant time outdoors. Finally, be patient and consistent with any new hair care routine or treatment. Hair grows slowly, and it can take several months to notice improvements. The experience of hair loss in older women, particularly during and after menopause, transcends the purely physical. It often carries a significant emotional and psychological weight that can deeply affect a woman's quality of life. In societies where a full head of hair is often equated with youth, beauty, and femininity, noticing thinning hair can trigger feelings of self-consciousness, embarrassment, and a diminished sense of attractiveness. Women may feel less confident in social situations, worry about others noticing their hair loss, or even withdraw from activities they once enjoyed. This can lead to increased stress, anxiety, and, in some cases, symptoms of depression. It's important to acknowledge that these feelings are valid and widely shared. The grief over losing one's hair, or the vitality it once had, is real. It represents a tangible change in one's appearance and can feel like a loss of a part of one's identity. However, it is equally important to remember that support is available and that women are not alone in this journey. Seeking supportive care is a sign of strength. This can take many forms. Confiding in trusted friends or family members can provide emotional solace. Joining support groups, either online or in person, specifically for women experiencing hair loss, can be incredibly empowering, offering a space to share experiences, coping strategies, and to feel understood by others who are going through similar challenges. Professional counseling or therapy can also be beneficial, providing tools to manage the emotional distress, build self-esteem, and develop coping mechanisms. Furthermore, consulting healthcare professionals, such as a dermatologist who specializes in hair disorders, a trichologist, or a dermatologist with a focus on hair, is a crucial step not only for diagnosis and treatment options, but also for reassurance and expert guidance. They can help differentiate menopausal hair loss from other potential causes, discuss realistic expectations for treatments, and provide a sense of control over the situation. Embracing self-compassion and focusing on overall well-being rather than solely on the hair itself can also shift perspective. Hair is one aspect of identity, but it does not define a woman's worth or beauty. The journey through menopause is one of profound transformation, and changes in hair are a common, albeit often challenging, part of this transition for many women.
The decline in estrogen is undeniably a central protagonist in the narrative of postmenopausal hair loss, altering the delicate hormonal balance that once favored robust hair growth and instead allowing androgens to exert a greater, often miniaturizing, influence on susceptible hair follicles. This shift can lead to the characteristic thinning and reduced volume that causes so much concern. Yet, understanding this intricate biological process is the key to unlocking strategies for management and mitigation. From fortifying the body with hair-supportive nutrients and adopting lifestyle habits that promote hormonal equilibrium and scalp health to exploring the ever-advancing array of medical and topical treatments, women have more avenues than ever before to address these changes. Coupled with gentle hair care practices and, crucially, the acknowledgement and support for the emotional impact of hair loss, women can navigate this aspect of aging with greater confidence and empowerment. While completely reversing the clock on hormonal aging isn't feasible, living well, feeling good, and maintaining healthy, vibrant hair to the best of one's ability through informed choices and proactive care is an achievable goal, allowing women to continue to feel like their best selves through menopause and beyond.